Hi, good morning, everyone. Today we're going to discuss patient positioning. So, patient positioning is vital to a safe and surgical procedure. So, proper patient positioning in the operating room it depends upon the type of surgery and the length of the procedure, access of client, anesthesia, devices required, and other factors. What are the goals of proper patient positioning? It maintains the patient airway and circulation throughout the procedure. It prevents nerve damage. It allows surgeon accessibility to the surgical site as well as for anesthetic administration, and it promote comfort and safety to the patient and prevents soft tissue damage. Now let's go to the different positioning. First is Fowler's position. The patient is in a sitting position, and the upper part of the body is elevated. Now, sometimes we call this as beach position, and it's often used for nasal surgeries, for abdominoplasty, breast reduction surgeries. And there are also risks when the patient is placed in a Fowler's position. This increases risk for air embolism, skin injury from shearing and sliding, and also DVT forming in the patient's lower extremities. Now, high Fowler's position, the patient is placed on a 60 to 90 degrees angle. And so another type of position is we have the supine position. The patient is placed on her back, and we call this sometimes as face up. The patient arm should be tucked at the patient's sides with the bed sheet secured with arm guards or two slats. And this supine position is commonly used in the following procedures like intracranial, cardiac, abdominal, endovascular, laparoscopic, and lower extremity procedures, and also ENT, neck, and face. The next position is we have the jackknife position. This is known as the knee chest or kneeling position, and it's used for colorectal surgeries. Now, the kidney position resembles lateral position except the patient's abdomen is placed over a lift in the operating table and bends the body to allow access to the retroperitoneal space. So the kidney rest is placed under the patient located at the middle of the surgical table. Now we have prone position. The patient is placed um, in a face down position and is lying on her abdomen. Prone position is used for spine, neck surgeries, neurosurgery, and colorectal surgeries. We have lithotomy position. Next is lithotomy position. The patient can be placed either in a boot style leg holder or stirrup style position. And this is typically used for gynecology, colorectal, urology, perineal, or pelvis procedures. There are also risks when the patient is in lithotomy position. This includes fracture, nerve injuries, hip dislocation, and muscle injuries. And we have Sims position. A patient is usually awake and help with the positioning. Patient will roll on his left side. So we have to place a body restraint on the patient to secure the patient from falling. And keeping the left leg straight, patient will slide the left hip back and bend the right knee. This type of position allows access to the anus. We have the lateral position, or we call this a side lying position. The lateral position patient be placed either on his left or right, depending on the site of the surgical. The next position is Trendelenburg. Trendelenburg position is used for lower abdominal colorectal, gynecology, and genitourinary surgeries, and central nervous catheter replacement. Today, I'm going to show you one practical performance of a physical therapy students who performs well in different kinds of body positioning. Let's watch together. Thank you for watching, and don't forget to subscribe and hit the button so that you will be notified every time I'm uploading a new video. Thank you very much and God bless.